understanding how a trigger point injection can reduce chronic pain and restore function. Both Drs. John Cho and James Chang are board-certified physicians with subspecialty certifications in pain management. Both Dr. Cho and Dr. Chang have advanced expertise in minimally invasive interventional techniques to treat both acute and chronic pain. A trigger point is a painful area within a muscle. It is commonly referred to as knots of the muscle that form with overuse and irritation. Many times, such knots can be palpable. Trigger points may irritate the nerves around them. Pain from trigger points can also be felt in another area of the body called referred pain. At times, trigger points can affect range of motion, strength, and activities of daily living due to increased discomfort. A trigger point can be treated in multiple ways, including the use of a corticosteroid or Botox injection. Trigger point injections can treat the following: muscle spasms, sciatica, neck, mid-back, and low back pain, tendinitis, osteoarthritis, myofascial pain syndrome, carpal tunnel syndrome, fibromyalgia, headaches and migraines, and temporomandibular joint pain. Chronic pain is typically associated with poor posture, injury to the muscle, and/or poor mechanics. Over time, this leads to stress of the muscle and joint disorders. Trigger points can develop over a period of time due to lack of mobility, overuse of a muscle, or sometimes even compensation of a weak musculature. The injection only takes a few minutes to perform. After numbing the area with a topical agent, a small needle will be inserted into the location of the trigger point. The physician will work to break up the area of the knot by moving the needle around the trigger point. This will help to break up the area of buildup to facilitate fresh blood flow and introduce pain relief. A trigger point injection may include the following: a local anesthetic, such as lidocaine, which blocks pain receptors in the muscle; a corticosteroid, which reduces inflammation in the muscle and connective tissue surrounding a nerve; and botulinum toxin A, which is known as Botox, interferes with the nerve signaling pathways and prevents muscle contractions. This is most commonly used for individuals that suffer from migraines or headaches. The benefits of a trigger point injection include increasing mobility and strength, decreasing pain to begin physical therapy, decreasing muscle spasms, while also increasing your quality of life. Depending on the severity of the trigger point, you can experience relief from the moment the injection is administered or up to a week post-injection. If you've noticed that your pain does not change or increase, please reach out to your team here at NJ Spine and Wellness. Visit us online at njsw.com or give us a call at 877-333-NJSW to begin your journey to a pain-free lifestyle with NJ Spine and Wellness.